Thank you very much. We are following the situation, the global situation very closely, and certainly there's an increase of cases in other countries. But what is more important for Malaysia is that first, we need to strengthen our border. So our border control has to be strengthened from time to time. Even now, we are under recovery MCO, movement control order, but we are still strengthening our border. So if we can do that, then we can assure those coming to Malaysia, then citizens coming back to Malaysia, then we have to quarantine them, and we isolate them, and we quarantine them, and we swab them as well. So to make sure that there's no infection from outside coming into Malaysia. So that is what we have been doing so far. But more importantly is that we need to control the local transmission. This is all the initiative we have done from MCO, EMCO, as well as we are looking into CMCO, and now we are looking into RMCO. This is to contain the infection locally. So if we can contain the infection locally, and if we can control our border, then I think we can control the virus in this country. But more importantly is that the strategy that we have, it works whereby we started with MCO, and we adopt this targeted approach to the locality as well as our high-risk group. So we identified 9 high-risk groups that we continue to do the surveillance. So we will enhance our activities locally and make sure that our surveillance will be improved, and our testing has increased from 1,000 in January to almost 34,000 now. So although our cases is less now, but our activity of surveillance and testing will continue. So if we can detect a cluster, for example, then our EMCO activities will be implemented. For example, even though we are in RMCO, recovery MCO, but if there is a cluster of outbreak, then we will implement our enhanced MCO in that region or in that place, and make sure that we screen everyone. And there are 2 things that we have done it differently from other countries. Number 1 is that when we identify someone positive, whether it's asymptomatic or mild symptom, we will isolate them and treat them in our hospital. If they are asymptomatic, we also will isolate them in our hospital. Second is that those Malaysian returnees coming home, we make sure that we quarantine them. In the past, we started with quarantine at home, then we have a compulsory quarantine in our quarantine center. Now we are going back at home again, but it's still compulsory quarantine for 14 days. Then we will do the swab day 1 and day 13. And if they are positive, we will isolate them. If not, after the 13th day, then we will issue them a certificate that they are free back to the community.